Hello, and welcome to the Ascend Health Show. I'm your host, Nick Angelis. I'm a nurse anesthetist and the owner of Ascend Health Center in Fairlawn. And I'm here with Dr. White from Empowered Health DPC. How are you doing today?
Doing great, thank you. Loving the sun.
Yeah, it's a lovely day, so now all of you know that we're not filming this in January. So I wanted to ask you today about Polyvagal Theory, because we're going to talk about the nervous system, and a lot of this I consider myself an expert because of my anesthesia background, but this is one of those shows where I want you to be the expert because you have many more practical tips than I would, since a lot of my tips involve an anesthesia machine and a lot of medications.
Fair.
And that's something about our culture too. Like a lot of times patients will gravitate toward like, well, what's the cool thing that you have for me?
Yeah.
And sometimes you'll probably tell them, well, why don't you just go play outside some?
Right. Sometimes it's the basic stuff. Sometimes it's the cool mechanics. So yeah, a little bit of both. That's great.
Well, why don't we start with like, what's the very basics of getting people better? Because obviously no one comes to you unless they're somewhat sick or feeling a little off. So what's like the most basic thing that they can do?
Yeah, absolutely. In terms of the polyvagal theory or helping people feel better from a nervous system standpoint, it can be as simple as you mentioned in kids playing outside. There's actually been studies where they looked at kids playing outside and that helped them feel better at baseline. It can also help with emotions and regulating emotions in kiddos. All spectrums of age, even in infants, it can help with weight gain. It can help them to digest things better.
Wow.
In elderly adults, they've studied it in helping with anxiety. So it really affects all ages.
And is that because, and we'll get a little scientific here for a second, and then once I confuse myself, we'll go back to So we have the sympathetic nervous system, which is your fight or flight, and your parasympathetic nervous system, which is your rest and relax. And during play, a kid is going between the two very quickly, and it's effective because normally when you're just watching TV shows, I know from my stepkids, like there'll be a slow part and they'll wander off to go do something else because it's like action all the time, completely sympathetic nervous system overload, dopamine surging. But in play, your very boring parts like playing hide and seek, I can't find them, this is lame, and your very exciting parts like I found them, this is great. So is that part of it where your sympathetic and parasympathetic learn to layer and turn off and off quickly?
Yeah, and I think the idea is the sympathetic fight or flight is not bad necessarily. We need it to be able to play and run around. We need our heart rate to increase for that. But it's that important part of going back and forth. We don't want to stay stuck there.
Okay.
Yeah.
And I think that's a lot of times, I know in natural medicine they actually call it being stuck, where the theory there is that, okay, when you're switched, then it's your parasympathetic working when your sympathetic should, and vice versa. And probably you mostly see the sympathetic working too much, right?
Yeah, I think that tends to be easy for us to kind of fall into a little bit more. And then there's also, maybe we'll get into more of it later, but that kind of freeze state, which can also be sometimes harmful as well.
Right, okay, great. So why don't you explain a little bit what polyvagal theory is?
Sure, yeah.
For us uninitiated ones.
Yeah, it's kind of a longer term, but really when you get down to it, it's just the idea that safety in our environment and how our body feels safe can impact our nervous system and therefore our body and our health in general. So we want that nervous system to be nice and healthy so we can feel safe. So they really are bidirectional. So how we feel and our health can really go hand in hand. Yeah,
in our last show we actually were talking about the mental health component of knee pain, which sounds completely ridiculous, but then I mentioned that, well, the alternative is you cut open the knee and put something titanium inside, so maybe it's worth looking into a little bit before you go for surgery.
For sure.
So I think that's a lot of what you're saying, that as a primary care doctor, you're looking at, well, what's the gentlest way that we can restore you back to health?
Yeah, absolutely. I think, certainly there are so many ways we can help patients, and there's levels of evidence. Some things are really strong evidence and some are low evidence. But really a nice place to play in is something that's likely very helpful but has a low risk of harm. That's a nice place to make recommendations.
Right. And so sometimes that does require some effort by the patient, but again, there aren't as many risks involved.
Right, yeah, exactly.
And we see that with psychiatry at Ascend as well, since primarily that's what we're doing. We're taking insurance, here's your medicine, come back and see us. We're a lot of times like, well, wait, it's not time to go to this med yet, or are these side effects worth it for the mental health benefits? And often that is a challenge in medicine, that, okay, this is so much better now, but now I have a problem with this. And probably getting the body to react less through polyvagal theory would help with that too. Almost allow you to your body to accommodate not necessarily medicines, but to accommodate change, really.
Yeah, absolutely. Yeah, our body is dynamic, and we want to keep it that way.
and also complex, for sure.
Yes.
Okay, so but the one part about the parasympathetic nervous system is it's mostly the vagus nerve, which is the largest nerve in our bodies. And correct me if I say something wrong.
Oh, you're fine.
Because I try not to refresh myself on any of this, because that way, otherwise I'd like get really excited and talk too much.
No worries.
It's a problem here on the show. It's a real problem.
You've got a lot of knowledge to share. I love it.
So why don't you tell us a little bit about the vagus nerve and how that interacts, and even ways to control it? That might be a good start.
Sure. Yeah, absolutely. I think it's kind of fun to go back to, I love words, so the word vagus or vagal nerve comes from the Latin word for wandering. So you may think of the English terms like vagabond or vagrant, so people that wander. So our vagus nerve wanders through our body. It connects to our ears, it connects to our vocal cords, our heart, our lungs, our digestive system. So it really does wander in a lot of places. And therefore its impacts are pretty wide-ranging. When we think about how do we impact it, it really goes back to our anatomy.
Okay.
So the vagus nerve we think about it as one nerve, but really it branches into two branches. The first branch, or a branch, is the ventral branch, which is a fancy word for our belly. So this I like to think about as kind of like a puppy belly. So a puppy's feeling good, they roll over onto their back, they want you to pet their belly. So they're feeling pretty good, they're feeling more social. So that's very much activated when we're feeling social, we're feeling safe, we want to engage more with people. And our vagus nerve responds in that way. So our ear with our vagal tone is actually tuned to hear voices better when we're in that kind of social state of that belly vagus nerve activating. Whereas the other branch of our vagus, the dorsal branch or the back of our vagus branch, that's a little bit more, I think of like a turtle shell, so that's that freeze state.
Okay.
So that's maybe when you think of like a possum gets really scared and they play dead, they're scared to death, so to speak. That's where that freeze state comes in. And that can come into play when people are feeling maybe traumatized or unsafe at work or throughout daily life. That vagal dorsal part of that nerve can be activated.
Sure.
So then the next part is, okay, but how do we get things to that belly part? How do we feel good, right?
How am I a puppy instead of a turtle?
Yeah, exactly. So that puppy part can be a lot of different ways to go about it. One way we mentioned before for kiddos is playing, so allowing more free time for play. Going to early in life for infants. We think a lot when I'm working with moms and babies, actually a mom's vagal tone, how well they're feeling, can actually impact how baby's vagal tone or baby's nervous system is. So helping moms to feel safe helps babies to feel safe, which makes a lot of sense.
Yeah, absolutely.
And then that, like we said, plays a role with helping babies gain weight easier, helping them to digest better, and their emotional regulation in general. When we get to kind of more older adults or people that are kind of in our age range, like middle age, older, there are a lot of different techniques that we can kind of use to hack our vagus system to some degree.
And it's a good way to do biohacking, because that's something I've run into a lot. Having a ketamine clinic, patients are like, well, I've read about all of these things ketamine can do for me. Sometimes like, no, we still need you to have a medical diagnosis that ketamine would be appropriate for. So biohacking is fine if we're talking about what you're talking about, some low risk activities that you can do to enhance your health. But a lot of times as a culture, we chase the shiny things. It's like, no, this could actually hurt you. I've done that with like supplements and like, no, this is really great for me. It's like, but is it really? Or is it just some mental thing that I need to get over of like being 110%? So. All right, my tangent's done. Continue.
No, I love that. Yeah. No, I think that's a great advice, right? We want to make sure, ideally, we're doing things that are low risk of harm before we're doing things that are potential high risk for harm. And sometimes you need those things.
And it is a good attitude to have of like, let me make my health even better.
Yeah.
Especially when we're talking about these type of activities as opposed to random chemicals. So.
Right, yeah, we want to optimize our health, so we're able to do those social things, engage in life. When we feel safe, we're able to take risks in business or take risks in our career. We're able to enjoy life, have empathy with others. When we feel safe, we're able to have access to a lot of these other states of feeling and being, which is really cool. Part of the human state.
Yeah, like the therapist at my office, I have to make sure that their own mental health is doing really well, because otherwise I know they won't be effective for their patients if they're worried about their own safety, if they have their own issues. And it's, we're always told as providers, like, well, you just have to like get past that and take care of the patient. And that's great advice short term, but long term, it's like a terrible way to live your life, as I'm sure we both know.
Yes, yeah. Longitudinal is looking in the long view is important.
Right.
Yeah. There are some other ways that I like to talk about improving vagal tone for adults. We can go through some of them if you'd like. One of them is kind of called the basic exercise. So that comes from Stanley Rosenberg, who's an osteopath. I think we'll have it in the show notes, but he wrote a book called Accessing the Healing Power of the Vagus Nerve. And he goes through applying osteopathic principles to help with our nervous system tone, our vagal tone. So one of them is the basic exercise that's in there. I can put a link in the show notes, or if you want to, we can go through it. It takes about a minute or so.
We can do it right now. This sounds really fun.
Okay.
Yeah, might as well learn something here.
So a lot of times, and again, if you're watching this at home, always ask your doc before you do things that you're not sure about in terms of safety. But usually when...
If we're massaging carotid arteries or whatnot.
Yes, exactly. So be safe. So usually I'll have patients lay down if they're in their office or at home, but we'll do it sitting up here. So I'll have people interlace their fingers behind their head, and it just kind of, in that ball of your head there, that back of the head, just kind of cradling it like a hammock. And then just gently allowing the shoulders to relax in, looking forward, just taking a couple deep breaths in and out at your own pace. And then as you're ready, just continuing to have the head look forward and then turning the eyes to look toward the left, and just continuing to take gentle, deep breaths, continuing to look toward the left. And typically after about 30 to 60 seconds, as people are breathing in and out, they may start to feel their face relax a little, or their shoulders, or they may feel the desire to swallow or yawn. And if it gets to about 30 to 60 seconds and they haven't felt one of those things yet, then they can kind of do it on their own. So maybe they swallow or yawn. And then once that's happened or they've done that, they can turn their eyes back toward the center. Take a couple deep breaths in and out, and then turn their eyes toward the left and just repeating that, taking some gentle deep breaths in and out, continuing to look toward the left. And they may feel like swallowing or yawning, or maybe their face just feels a little softer, or maybe they'll swallow, yawn on their own, and then they'll look back towards the center for another breath in, out, and then they can relax their hands and they may feel a little more relaxed or a little tuned down. Typically I'll recommend that just a couple times a day for patients, usually in the morning or the evening, just as kind of a nice way to bookend the day.
Right. And I can tell patients now too, when they call with anxiety, like, look, about minute 13 in this video, this is what you need to watch.
Yeah, there you go. I think it's a really just nice tool. I used it with a patient the other day in the office who was experiencing some trauma, and she just kept yawning afterwards. She just felt so much more relaxed. It was really cool to see in action.
Well, I think part of it too is that we need to tell our brains, like, it's okay to be in a state of relaxation because again, our culture often doesn't encourage you to be on it for your job. You have to be on it for the kids. You always have to be going and 100%. It's like, well, no, that's not helpful at all, especially not long term.
Right.
I mean, even when so I'm coaching soccer again, and I told them we just had our first practice, like, listen, I might yell at you during a game from the sidelines. Don't listen to what I'm saying. If you hear me or parents yelling at you, it means someone's open. It's either you or your teammate or the person you're supposed to guard. So don't listen to the words. Just know what that is, because it's what you said about the sympathetic nervous system. It's not conducive for learning. Like, oh, I need to pass it to the fullback and then cut toward the goal. It's like, no, if you hear screaming, here's what you need to do. Don't pay attention to the words I'm saying to you.
Yeah, I love that. You're like applying it in everyday life. That's so great. Yeah.
And that's because, again, like even for, this is terrible, but I had a friend in anesthesia school. He was like, you know what, I would have a beer and then I would take my test, because otherwise I'd be like, oh, I'm going to miss this. What if it's A? What if it's C? What if it's B? So I'm not recommending that as a way forward, because we will see that. Like, it's the stereotypical, like, well, once I have my glass of wine for the night, then I can tone down. And long term, it's not appropriate. But you see the idea of like, wait, if I can channel into like this rest and relax part of my life. So, and is it more unique to Americans? Because when I go to Greece and visit my relatives, we'll go out for lunch, and an hour and a half in, I'm like, we done? Like, we do something else now? And they're like, no, this is what we do. We sit and talk and enjoy ourselves.
Yeah, it's like a different pace of life. Yeah, for sure. I think they've seen that with some of the like blue zone studies. Yeah, I think you're right.
So part of this is forming new habits and not giving in to the peer pressure of like how everybody's living their lives. Like being okay with not being 100% all the time.
Yeah, and like finding, you know, like you mentioned, we reach for external things to help with our nervous system, like maybe substances or drugs or medications. And sometimes those things are needed in terms of meds, but these are some nice bodily ways to kind of go from the outside in to tell our nervous system, hey, it's safe, you can relax now, work is over, or whatever.
Well, maybe a way to think of it too is, so when we first started our clinic in 2019, we mentioned we have holistic psychiatry and pain management. And then I would tell patients better, like, eat better. They're like, I failed 7 drugs. Do you think an avocado is going to fix this for me? So then I realized, well, no, we actually do need a strong medical intervention. But then once we've started that, you're going to improve quickly. And then you really need to incorporate all these things that you ignored before because you thought people were being rude to you for saying that you need to pray more or do more yoga or whatever. So it is sort of that interlay so that you don't need quite as many, as we said, like high risk interventions where there could be side effects. Yeah,
it's a nice, in terms of like integrative or functional medicine, it's just another tool to add to the toolbox. It's another option to add.
And you're still studying for some more functional medicine certifications, right? How's
I just took my certification exam, so I'm just waiting on that, and I'll be all finished. Yeah, which is so nice. It's been lovely just doing family medicine and adding in some functional medicine as people need it. I think it's just been a really ideal way to practice.
So sometimes you'll prescribe medicine because it's appropriate, and then other times you'll say, well, why don't we try this exercise first or this habit change or whatnot.
Yeah, exactly. And it's very much patient driven. I always tell patients I'll make recommendations and I'll work with you, but I never tell you have to do anything. These are all options and we'll find what works best for you. But it's just nice, again, to have more tools in the toolbox to be able to offer care.
Right. And I think part of that too is letting patients know what they're in for. I mean, that's really why we do this show, because prospective patients of Ascend Health Center watch it and then think, he's weird and random, this isn't for me. And that's perfectly fine. It saves both of us some time and effort.
Sure, it does a good fit. I was talking about this with the mentor the other day. You want to fit well with, you feel like you fit well with whoever's taking care of you, or at least well enough to be able to get some therapeutic benefit.
Right, and it's a challenge too, because on the one level there's trust, which is absolutely necessary, but then there's also competence. And sometimes as patients, it's like, well, I really trust them and they're okay, or man, they're really good. But although sometimes I also say, look, this provider is very rude, but they're also very smart, and that's why they don't bother with a bedside manner. But obviously, it's best to have a combination of both.
Yeah, I agree. I give that warning sometimes too. I think good to let patients know what they're in for, and people have different styles, and that fits well for different patients, right? There's as many different types of patients as there are types of doctors, I think. So.
And so, a lot of what you did with the exercise earlier, there's vagal nerve stimulators, there's other ways. I mean, I assume partly the way that works is because you're stretching the smooth muscles of the eye, which, and I could be wrong,
Yeah.
but you're stretching the smooth muscles of the eye, which sends a signal to your vagus nerve, like, okay, it's time for us to take over.
Yep, yeah, it engages your social interactions, which goes back to the vagus tone.
And I mean,
Yeah.
I've seen extreme versions of that in surgery where they'll pull on those muscles and then I'll see no heart rate for 10 seconds. So I think that's
So
part
you
of
like very much have seen that in action.
yeah,
That's so
I have.
interesting.
Where they're
yeah.
like, you will see a vagal response. And I'll say, when will their heart start? And I tend to, so this is because I'm perhaps not sympathetically tuned enough. That's usually how I ask it, like, when will their heart start up? And so I probably have
Yeah.
some room to grow to get my sympathetic nervous system going more.
Yeah, no, I think sometimes you gotta have the funnel on to do the job. So, yeah.
So is part of it for patients learning when to kind of take the funnel off? Because we've already mentioned a lot that we've said you can't really learn while you're in a sympathetic state, that you need this rest and relaxed state to learn, which makes it sound like you should always be eating when you're learning, honestly. Like being in that, I'm safe, I can learn, I
Yeah.
can form a new habit.
Yeah, no, both are super important. And when we think about that sympathetic fight or flight mode, we actually don't have access to some of that frontal part of our brain as much. We're not able to think more critically.
Okay.
So for some people, like when we think about advertisements and kind of the fear in some of those, it can play well into advertising. People may
Right.
not be thinking as deeply, which is kind of an interesting application of it.
Yeah.
But.
I was reading something the other day, and I'll try to make this very quick since yet another tangent, how Coca-Cola noticed a generation or two ago that no one was drinking Coke in the winter. So by making Santa Claus red and always drinking a Coke, like they actually changed the culture where even Christians now celebrate Christmas more than Easter. And it was because Coca-Cola realized there must be some way that we can incorporate Coca-Cola with winter so our sales don't slump.
Interesting.
So there's so many things that we think are like, this is the way we are. It's like, nope, somebody's selling me something.
Right. Yeah, that plays a role too. Yeah.
So how, as providers, can we encourage patients that no, we're not selling you something? For example, you're doing direct primary care, and you don't take insurance, right?
No.
So it is something where it's like, look, you're not using the Groupon for a restaurant you don't like. That's usually how I describe insurance. You're just getting what you need and then you're leaving.
Yeah.
Is that more of how we're saying, like, because of the insurance model, we're often forced into these weird situations where the patient doesn't know what's going on, they don't know how much they owe, what they're paying. So your
it's not
model,
very transparent.
right? And your model probably also allows, like, well, here's how much it is. Is this worth it to you? And people can make conscious decisions about their health, which is really important regardless of what they decide.
Right. Yeah. I think transparency is super key. I keep everything on the website, and I think too, it's patients knowing what they're signing up for, right? Like being able to have more time with a physician. Like the insurance model, oftentimes they do a little bit with time billing, but for the most part, it's 10-minute visits. It's quick visits in and out. Whereas when you have your own practice like I do, I can spend a couple hours for a new patient, an hour and a half to an hour for follow-ups, whatever patients need. We can flex it.
Well, why don't we talk just for the few minutes we have left, at least of one system with polyvagal theory and what we're saying about the parasympathetic nervous system, and that is digestion, because that is one of the number one systems where our medical system can't solve it within like a 10-minute visit. Because it's so complex. Like you mentioned, the puppy belly, there's serotonin that's released in the gut. So what's something that we can take away from this conversation with the parasympathetic nervous system and digestion?
For sure, yeah. I'll often, especially with patients with digestive issues like IBS, etc., I'll have them do gentle, deep breathing before a meal. That just gets them into that more rest and digest mode. So when they do go to eat, things are moving a little bit easier.
Because it's often coupled with anxiety, depression. Like a lot of times those are all interwoven. Okay.
Yeah,
Sorry,
yeah.
continue.
So no, you're great. Yeah, I think that's a great line. Yeah, especially with IBS, we see that so commonly, right? Anxiety, IBS, digestive issues. But yeah, just gentle, deep breathing before a meal can be really helpful, or as they're able to throughout the day.
So a lot more mindfulness about your digestive system too, rather than just blindly like reaching for things while you're doing something else.
Yeah. There's also some cool apps, like one's called Nerva, so it's gut-directed hypnotherapy. So it gets into that idea of our nervous system resting to be able to help with IBS specifically.
Sure.
Yeah.
So it sounds like the polyvagal theory for digestion, a lot of it is not being distracted. So maybe putting your phones away while you're eating, just focusing on the meal and letting your system focus on digestion.
Yeah.
So a lot of times our brains are firing in all these directions, and obviously the brain's the only organ that tells us things directly. So it's like, nope, sorry brain, this is stomach's time.
Yeah.
You take the back seat right now. It's stomach's time to digest food and do so appropriately, and you can go back to all your thinking afterwards.
Right, yeah, exactly. I think that's a good way to put it.
So how can patients reach you if they're interested in learning more or having you be their doctor?
Yeah, they're welcome to go on the website and
Okay.
check it out. I've got most of the information on there. And then I do offer free meet and greets for a few minutes over the phone, so they're always welcome to call and see if it's a good fit for them.
Okay, great. And you're in Rocky River, correct?
Yep.
Great. Do you do some telehealth too, or is it all in person? Because, by the nature of what you're doing, a lot of it is more person to person, spend time with patients.
Yeah, I usually like to see them in person just for the first visit, but I
Okay.
do offer phone and video follow-ups, so I can always do that for patients that are a little further. I have some that are more homebound, so we
Sure.
do some more video visits.
Okay, great.
Yeah.
And at Ascend Health Center, we're in Fair Lawn. It's the same thing where the first visit should be in person, so we get to know each other better. And then from there, whether it's psychiatry, counseling, a lot of that can be telehealth as well. I mean, since I do ketamine infusions, you really can't do that telehealth. The transcranial magnetic stimulation and some of the other things we do. But I think it is important to meet people where they are. Sometimes we'll tell patients, like, no, this type of visit won't work over the video camera. We need to see you. And then other times, like, nope, you have a quick question and it's too complex for us to answer without really getting into what's going on. So, here's a telehealth link or whatever.
Yeah,
So.
that's nice. Very flexible.
Yeah. Well, thank you so much for coming on the show today.
Yeah, thanks for the invitation. This is fun.
Absolutely. And thank you all for watching today.